London's Imperial College has published a research on the need of hospitalization for Omicron cases. The study says the risk of hospitalization for Omicron patients is 40 to 45% lower than for patients with the Delta variant. The study analyzed data from PCR test-confirmed cases in England between 1st and 14th of December. Imperial College researchers say that the risk of any visit to a hospital was between 20% and 25% lower than with Delta. The study claimed 40 to 45% reduction in hospitalizations lasting one night or longer. However, they added that the reductions in hospitalization must be balanced against the larger risk of infection with Omicron. Omicron significantly reduces COVID antibody protection generated by vaccines. However, the estimates from the research suggested that people vaccinated with 2 shots remained substantially protected against hospitalization. This holds even if protection against infection has been largely lost against the Omicron variant. The study has not been peer-reviewed, but it adds to growing evidence about disease outcomes with Omicron. Omicron's virulence is at the heart of scientific and political debate in many countries. The Omicron strain is spreading at breakneck speed. Another paper from Scotland found that Omicron is associated with a 2/3 reduction in the risk of COVID-19 hospitalization. It also showed that a booster vaccine offered substantial additional protection against a symptomatic infection. The study examined COVID cases recorded in November and December. Both the British research confirm a trend first identified in South Africa. The South African study also suggested reduced risks of hospitalization. People diagnosed with Omicron in South Africa were 80% less likely to be admitted to the hospital. This is in comparison to those diagnosed with another variant between October 1st and November 30th. Among patients admitted in that period, those with Omicron had a similar chance of developing severe diseases as those with other variants. However, the study found that people who were hospitalized with Omicron were 70% less likely to develop severe disease. Okay. Joining us now from Pretoria is the National Chair of South Africa's Medical Association, Dr. Angelique Coetzee. She is also one of the first doctors to treat Omicron. Thank you very much for joining us, Doctor. We are glad to have you on WION. COVID-19 cases appear to have peaked in South Africa's Gauteng province about a month after the Omicron variant was first detected there, and the impact of surging infections has been less severe than previous waves. Doctor, please start by explaining the peak to us.
Yes, thank you for asking us. We have, this is now, from today, we are now in our 6th week of Omicron from the clinical perspective. So what we have seen, our numbers did double, especially those first 2 weeks, as you have now seen in other countries as well. However, although it was doubling, the amount of patients admitted to ICU and high care did not increase as much as we would have thought and what we have seen in the 3rd and the 2nd wave. So also the clinical picture, which I have said many times at primary healthcare, is that of predominantly a mild disease, meaning that with mild disease I can treat you outside of hospital. I can treat you at home, you don't need oxygen, and you should be fairly well. You should not really progress to severe disease. And this is exactly what we have seen.
Right.
And I remember right in the beginning, everyone didn't, or most countries didn't believe us. And I also consulted widely with my other colleagues working in the same setup than I do, and we were all the same. It's a mild disease.
Right.
Not saying that you won't get severe. Please don't get us wrong.
Doctor, what do you make of this study that hospitalization for Omicron patients is 40 to 45% lower than for patients with Delta variant? What has been your experience on the variant in the past month?
Exactly the same. Actually, it's even lower than that in South Africa. If we look at the numbers, two things. NICD, our National Institute for Contagious Diseases, released yesterday a document where 309 people died, whereas 40 were fully vaccinated and 269 not vaccinated. So it's a very important point to take note of. And then if we look at our stats, on the 17th of December, although we tested 23,400 patients positive, only in hospital were about 528 in ICU. And if we then look at our daily cases with Delta, on the 8th of July, we tested 19,900 patients positive, but 17,404 was in hospital, of which 2,597 was in high care. So, and again, our hospital stats stays more or less the same. Between we see around about 600 patients admitted. Right. It's not all of them, again, admitted for Omicron. You need to understand that as well.
Right. Okay. My final question to you. The Omicron variant is fast spreading in Europe and in America. Many are worried that this festive season, just like in 2020, will be wasted. What would be your advice to governments reeling under this new variant?
So what we have done in South Africa, I think it's extremely important to make sure that people are mask wearing. The government should be very, very strict on that. The mask wearing, the social distancing, and the good ventilation, extremely important. Then try to get people away from huge gatherings, especially indoors, and get the people vaccinated. And those that's vaccinated, fully vaccinated, above a certain age group, also people with comorbidities, as well as your people with immune compromised diseases. Let them get their booster shots, and then educate your people. Educate them on what is the symptoms of Omicron, when you need to go and see a doctor, when do you need to get tested, and educate your doctors around to test these patients, and start them as early as possible on low dosage of cortisone. In Delta, you would have wait about 7 days before you start cortisone. Here, right. It's the opposite. The quicker you start, the quicker the patient is better.
Doctor, I'm just curious, fully vaccinated people too are falling prey to the Omicron variant. So does this raise question on the efficacy of vaccines?
It's true. We have seen it. I have said it, I think, since the third week already. We saw it. We saw vaccinated people get breakthrough infections, especially those that's been vaccinated more than 3 months ago. Yeah, we see it. We see patients that had previous infections, not vaccinated, get reinfected. Yeah, we see that. It's not a phenomenon that now all of a sudden is there. But, however, those people that has been vaccinated, their symptoms, although mild, are less intense experienced than those who has not been vaccinated. And then again, the unvaccinated people are ending up in ICU, where we see that the vaccines still do give you a protection against severe disease in hospital. But on the mild side, no, we know that Pfizer gives you around about 33% with Omicron. It was much higher with Delta, but with Omicron 33%. But on the clinical level, when I look at the patients clinically, when they sit in front of me, do I see a 33%? No. I see them as, not having as intense their symptoms. And for me, as long as I can treat them, get them out of hospital, right, and get them better within 5 to 7 days, I'm happy.
All right. Thank you very much, Dr. Angelique Coetzee, for talking to WION and for your insights today. WION is now available in your country. Download the app now and get all the news on the move.